How can we as a community minimize the impact of third wave? The cheapest way is COVID appropriate behavior. Please wear a proper mask covering your nose and mouth, at least triple layer. Ensure social distancing whenever you are stepping out of the house, and of course, good hand hygiene. Whoever is eligible for COVID vaccination, please go and get up to date. Avoid unnecessarily travelings and gatherings. And with the flu season being around, please go and get your flu vaccine up to date. Thank you. Impact on the family when the child is COVID positive and how to manage it. Of course, COVID in a child leads to a lot of panic in the family, missed work days for the parents and the school for children. Most of the time we know now that COVID causes mild symptoms in children and it can be managed at home with proper video consultation follow-ups with your pediatricians. You should be able to manage your child's fever, runny nose, cough, vomiting. Ensure they are maintaining good hydration, keep them isolated as per the protocol, and you should know what are the warning signs when you need to get your child to the hospital, which includes if their fever is continuing beyond 4 days, they're vomiting and having loose stool where they're not maintaining hydration, if they're having a lot of rashes with high-grade fevers, all those are warning signs to get them to the hospital. Stay safe, stay happy.